Hello, everyone. My name is Stacie De Lucia. I am the dietitian at Sanctuary Functional Medicine. Today, I'm going to be talking about the 5-hour gut protocol. This is a protocol that we do with most patients that come in for an intensive program. So I'm going to be running through that today. This one specifically for adults. So make sure to pay attention, run it back if you need to read through it or listen again. And then your personalized plan will be in your portal, but this is a general overview of why we do the gut protocol and what it is. So what does it stand for? 5R stands for 5 different R's: remove, replace, re-inoculate, repair, and rebalance. So we go through each one of those, and it includes a different type of treatment that all comes together to make sure we are really healing the gut as a whole. So why do we do this? Why do we do the gut protocol for everyone pretty much? So even if you don't have GI issues, the gut is the epicenter of your immune system. It's directly correlated with your mental health. It's where we produce most of our serotonin. So it can affect sleep. It can affect stress level, anxiety. It also affects autoimmune conditions, food sensitivities, and even chronic fatigue and skin issues. So it is the epicenter of a lot of things that can manifest in the body as symptoms. So we always want to start with the gut just to make sure that we're healing that up before and as we identify root causes and start to treat them. So the first step is remove. So most patients that are in this program will do step 1, definitely. This is the diet side of things. So the diet side of things, we do want to clean up the diet to make sure we're reducing inflammation, because most people that come into the intensive are dealing with some kind of inflammation. So in order to do that, or make sure at least the diet's not contributing to inflammation, we want to start cutting back on common food sensitivities and common inflammatory foods, specifically in the American food supply. So gluten, dairy, soy, corn, refined sugar, flours, and then harmful or fake additives such as fake colors, flavors, preservatives. We want to really start cutting back on these. So start reading labels, start seeing what you're putting in your body just to make sure that it's not adding more inflammation while you're going through this program, because you really are investing in your health. You want to really not cut corners because this is a bigger deal than a lot of people realize. So even for just for the first 4 weeks before we meet, if you could start cutting back on these foods. Gluten, if it's something that has been a trigger for you in the past, but you feel better with it, just start to minimize it and get high quality versions, whether it's sourdough or einkorn. If you freshly mill your own flour and bake with it, those are usually okay while we're waiting for the root causes that we're identifying. But if you've never tried eliminating gluten, that we highly recommend doing that just because it is a problem for a lot of people, especially if they're dealing with chronic inflammation. So gluten is the protein in wheat, barley, and rye. So you'd be cutting out anything with wheat, barley, and rye, which is in a lot of breads, bagels, pizza crust, pasta, things like that, and switching to gluten-free versions or just not doing the packaged things altogether. There are gluten-free handouts that I can provide for you, so please message me if you need those, if you've never done it before, but that's a big one that we start with. Dairy, this is something that a lot of people do tolerate, and so I recommend if you are going to eat it, that you get grass-fed, local, raw, or organic. Even sheep and goat dairy is easier to digest, so finding some of that at the grocery store is great too. But if you know that you're sensitive to dairy and you get digestive issues or mucus production, a lot of people get that with dairy, then we do recommend for the next couple of weeks just cutting it out. Most people are okay with butter and ghee because it's very low in lactose and casein. So that's one exception that could be okay. But if you want to just try it and see how you do without it, that might be good to also cut that out for the first 4 weeks. Soy and corn, these are things that tend to be genetically modified in our food supply and often have high pesticide content. So we do tell people to cut those out for a little bit, but also, again, if it's too difficult to do that, try to just get organic versions, and whole food versions. So whole food organic tofu and edamame versus processed soy isolate or soy protein. Same thing with corn, not processed versions, but whole food organic corn. Those can be exceptions that you can keep in. Then refined sugar and flour, really focusing on the sugar piece here. Even if you're not going to cut it out completely, you should keep your added sugar low. Anything that's not naturally occurring in a product, that's added. Like even if it's cane sugar, maple syrup, honey, coconut sugar, those are good. But when you add them to things, it starts to add up and then can create or produce more inflammation in the body, especially if there's an overgrowth of bacteria or if there's mold or something like that. So you do really want to make sure that you're cutting back on added sugar as much as possible. So I recommend no more than 1 to 2 teaspoons at a time and spacing it out, like a teaspoon of honey in the morning in coffee or something, and then maybe in the yogurt in the afternoon. As long as you space it out and keep it minimized, that should be okay. The only alternatives to sugar that we recommend, it's in small amounts if you need them, are pure stevia and pure monk fruit. No sucralose or aspartame or sugar alcohols because those have shown to have negative effects on the body, especially in with regular use of them. So we really recommend keeping those out as well. If you have other sensitivities you know of, like you're sensitive to almonds or you have an allergy, definitely keep those foods out for now because we haven't even really started the healing process. So really keep all of those out if you have already identified those sensitivities or common triggers. Keep those out in the next 4 weeks before we meet. And then by the time we meet, we'll have more concrete answers to go off of. So definitely check in your personalized plan that your provider has provided for you on what diet to be doing. But this is a general anti-inflammatory or low inflammatory diet. And this is where we want to start with the gut protocol. Okay, so step 2 is replace. So this one, not everyone will be doing, but it is really important, especially if you have had prolonged issues with malabsorption, maldigestion, or indigestion. So we really want to make sure that you're breaking down your food efficiently to then be absorbing it efficiently. Over time, with prolonged stress, inflammation, antibiotic use, illnesses, things like that, um, the digestive enzymes that break down our food, like protease, lipase, amylase, they break down protein, fat, carbs, can get lower in the gut, and then we can't break down our food as efficiently. So we get sluggish or bloated, fatigued after we eat, and then even develop new sensitivities. So we want to add more enzymes to the gut to break down food better so we feel better after we eat, and then it will naturally increase enzymes over time, especially as we heal the rest of the gut. So most people will be on a digestive enzyme where they take one before each full meal. However, some might be on one that's a chewable capsule, so refer to your notes to make sure you're on the right dosage and you're taking it the right way. But the best thing to do is take the digestive enzyme before the meal because we want it in the gut so that when you start eating, it'll start breaking down the food. If you do forget, you could take it during or up to an hour after, but it is most effective right before. This doesn't need to be refrigerated at all. You can just pop it in your bag. I recommend taking it with you when you eat out, when you're going to like a wedding or a party or barbecue. You can even take 2 for most digestive enzymes before a bigger meal if you're eating things that you know you're not used to or that's heavier. If you just have a snack or something light, you don't necessarily need to take the enzyme. It's really just with bigger meals. That's really when you want to be taking the digestive enzyme before that meal. So this is the first supplement that we're doing, and this is step 2, which is replace. Okay, step 3 of the gut protocol is re-inoculate. And this basically means that we're adding something, inoculating the gut with something, which is probiotics. So, a probiotic is a good bug, a good bacteria that we want in our gut. Sometimes we get off balance, again, with stress or inflammation or long antibiotic or medication use. The good bacteria can get low and the bad bacteria can get high. So we really want to make sure we balance that out to have a good symbiotic culture of bacteria that are healthy. Bacteria are really important for breaking down molecules in the food, for producing vitamins and minerals, for absorption, and just they do affect our mood and our immune system as well, like I mentioned earlier. So we do want to make sure we have the good stuff in the gut and the bad stuff not in the gut. So if we inoculate the gut with the good bacteria, that helps drive out the bad, and creates this really happy community that keeps our gut very healthy, which trickles into the rest of the body, right? So when we do a probiotic, most of them we want to have at least 8 different strains of bacteria to give more diversity rather than just 1 or 2. However, some people might be on specific strains of bacteria for a specific condition. So definitely check your notes and see which one you're on. But most patients will be on this one that we have called Therabiotic Complete, which is 8 different strains and about 25 billion organisms, which sounds like a lot, but if you think about how we have hundreds of thousands of billions of different organisms in the gut, that is small in comparison to the whole gut. So we want to do something around that, but again, check with your provider which one you're doing. Most of them will be refrigerated because we're trying to keep the good bacteria in the capsule alive, but most of them can last for 30 days out of the fridge. So look at your specific one that you have. Some are even shelf stable, especially if it's a spore-based probiotic, but most we want to keep in the fridge just to keep the efficacy of the product. And most will be 1 capsule a day. We do recommend taking it away from food just so it gets absorbed better, doesn't get diluted by anything. But if you get nauseous or it just doesn't feel great, you could take it with food as well. That's okay. And then we do recommend just the 1 a day. And most people we say just take it before bed so you don't have to really worry about. Sometimes it gives a little gas and bloating in the beginning because we're adding bacteria. Just like if you ate a lot of yogurt, you might get a little bit gassy because of all the alive organisms in it. So if you take it before bed, you don't really notice, a little bit of gas and bloating. So that's part of re-inoculating. And prebiotics is something we want to re-inoculate with too, which is really coming from food. Some people are on a powder, but most people can just get prebiotics through food. This is a fiber that helps feed the good bacteria. So the good bacteria need to be eating something, right? They're going to be eating a lot of what we're eating, but they really love fiber. So things like gluten-free grains, legumes, and then most fruits and vegetables have fiber in them as well. Specifically starchy things like sweet potato, winter squash, plantains, even some nuts and seeds, have fiber in them as well. So make sure you're getting diversity in the diet, just so the diverse things are feeding the diverse amounts of bacteria that are in the gut. And the ones that you're putting in, we want to feed them with good things. So definitely make sure you're eating some fiber. If you're on a specific diet that doesn't have a lot of fiber, that's okay. You don't necessarily need to do it all the time or right now. That's something we can work on later if we're starting really basic with a specific diet. But definitely make sure you get that probiotic in and refer to your notes for which one that you will be on. Okay, step 4. This is the biggest step that we have as far as supplements go. It's about repairing the lining of the gut. So many of you have probably heard the term leaky gut. What happens over time with stress, inflammation, viruses, illnesses, just old age, the lining of the gut is supposed to be have tight junctions on the outside of it or around it. And over time, those can open up and get leaky where things can start coming in and out that are not supposed to be leaking out. And so we need to build that back up and create those tight junctions again. When it gets leaky, we start to, toxins can leak out of the gut. That's how we get food sensitivities, inflammation, GI issues, IBS. All of those things can start happening. So to make sure that we're not having leaky gut and everything is staying in there that needs to stay in there, we want to make sure we're building that lining back up. So these are the essential nutrients that we use to do that. Vitamin A, C, and E, and then omega-3s. And then usually we do one of or the other of these bottom 2 here, L-glutamine and zinc carnosine, or something called a gut nutrient. So I'll go through these. Again, not everyone will be on these, but this is the basic protocol that we usually do. So vitamin A, you might have heard of it for the immune system, but it's also really good for hair, skin, and nails because it helps growth and repair of specifically in this case, the lining of the gut. That is really important. And usually everyone is on just 1 drop of that a day because it is very strong and powerful. You can also get this from orange foods such as sweet potato, carrots, winter squash, bell peppers, all that good stuff. Vitamin C and E are antioxidants, which means that's protecting the cells from oxidation, from basically opening up themselves and getting destroyed. So this is fighting off inflammation, especially kind of cooling down inflammation in the gut if it is irritated. And then it supports the immune system again, which is in the gut. So those will be varying dosages, but usually people are on vitamin C, 2000 milligrams a day, and then E is usually 1 capsule a day. So make sure you look at your notes for those. And then omega-3s are very important for whole body inflammation. It's really hard to get enough omega-3s in the diet because you have to be eating a lot of really good fatty fish. And especially in Tennessee, we don't have access to a lot of fresh fish. So it is hard to get it in the diet. So we usually supplement this for most patients. Really good for the brain, the heart, and then reducing whole body inflammation. Specifically also helps with the integrity of the lining of the gut. That's usually just 1 capsule a day of an EPA DHA blend. And then the last component here is either gut nutrients or L-glutamine and zinc carnosine. These, the zinc carnosine is specific for helping to feed the cells that build up the lining of the gut. So both of these will have that in it. However, some of you will be on L-glutamine, which is a powder, which is more gentle for building up the lining. It's an amino acid that kind of works like collagen for hair, skin, and nails, but this is specific for the lining of the gut to build it up. Or some of you might be on gut nutrients, which is a capsule that's 5 a day away from food that has a bunch of herbs like marshmallow root and aloe and licorice and the zinc carnosine to soothe the gut and then build it back up. However, it has a lot of herbs, so sometimes it can be irritating for certain people that have more extreme GI issues. So likely you'll be on the L-glutamine, or we might be holding off on that altogether. But gut nutrients and L-glutamine, zinc carnosine is essential for really making sure the leaky gut gets repaired. So you'll likely be on either of those. Okay, the last step, the last R of the 5R is rebalance. And this is really something that tends to be the hardest for people, but it's really important. So we want to make sure that everything else we're doing in the 5R kind of comes together here and making sure that we're rebalancing everything else in our lifestyle, basically. So we want to make sure that, you could take the supplements, you can eat clean, but if you're not sleeping well, if you're not hydrating, if you're not taking care of all of those lifestyle things, then likely the supplements and the food won't work as efficiently and you won't heal as efficiently. So we don't want to overlook these things. So try to take a step back as you're going through the next couple of weeks and just say, hey, is there any areas of my life that I need to work on, either slowing down or getting into a better routine with? Am I hydrating adequately, or do I feel dehydrated all the time? Am I sleeping enough, or am I struggling with that? Am I moving my body enough, or am I slacking on that as well? You don't need to do everything all at once, especially if you're struggling with chronic fatigue or pain. We're not going to push you to do those things, but we do want you to reflect and see, is there any areas in my lifestyle that I can tweak or work on, even just having a goal for them? So try to pick 1 to 2 things in this list, or even if you're thinking of something outside this list, maybe write it down in your notes or in your welcome packet. And then when we meet, we can chat about that. Or we have supportive, health coaching and other therapists and things that we have access to as well that we can add on in the program. So that's something that we can dive into a little bit deeper, but it's something that we definitely don't want to overlook. So make sure that you're reading through this, looking and seeing in your lifestyle if there's any areas that would be helpful. And then in conclusion, this 5-hour gut protocol, yes, it is a lot. We would like most patients to be on it for about 2 months, but it is really important. It's the foundation of everything else that we do here at Sanctuary. So even if you don't have GI issues, this is something that we always want to look into and want to try to heal to really make sure that we're kind of touching all the bases and checking all the boxes before we start any other treatments. So take it 1 step at a time. If you need to start slow with the supplements, that's okay. And please reach out if you do have any questions or concerns, and really make sure that you refer to your specific plan that will be in your portal messages from me or from your provider, to make sure that you are on the right plan that's individualized and tailored to you, because this is general, of why we do it and what most patients are on, but everyone is unique and individual, and that's the point of functional medicine and here at Sanctuary. So make sure you read through that in your portal, and if you have a hard time finding it or figuring out where to find it, please call us and let us know, and we'll figure that out for you and run you through it. Thank you so much for listening. Please keep me posted if I can help in any way within this gut protocol, and I look forward to meeting you in the office or virtually in our appointment. Thank you.